Hey ladies, it's Kristen Barry here with Ruby Ribbon, and I'm excited to talk to you, to introduce you to Kristen Barry. And she is a breast health coach, and she's also the founder of Space Coast Thermography. So I wanted her to come and talk with you guys about breast health. And it is National No Bra Day, so the importance of not wearing an underwire, and also the things that we can do to help lessen our chances of breast cancer, and maybe some other ways that we can find out for early detection. So I'm going to let Kristen go ahead and talk. All right, thanks for being here.
Thank you for having me. Happy National No Bra Day.
Yay, it's like my day.
It's a good time. I love fall. I love the fall weather. October's Breast Cancer Awareness Month, and I love helping people to be aware and to understand their risk and what they can do. And then you throw in National No Bra Day on top of it, and it's a great day.
Oh yeah, this is like my favorite day of the year. But I've been bra free for 4 years now, and I know you've been bra free for much longer.
Yeah, so it's a wonderful thing. So let me tell you a little bit about, I'll tell you just quick synopsis for the people listening about me and what I offer, and we'll get into discussing what we can do to help with our breast health, because that's the goal. So I'm a breast cancer survivor. I was diagnosed with breast cancer 10 years ago. I was only 43, so it does happen, and more often than we think, to younger women. I started my thermography practice because a mammogram missed my cancer 3 years in a row. I have dense breast tissue, and we'll get into talking about what that means in a minute. And so I started doing all of my research, and I found out that thermography is a non-invasive, radiation-free way of detecting if there's changes going on in the breast tissue before you get to where a solid tumor is forming. And hopefully you can alert people, women, to be preventative, to make some changes so that they don't end up getting diagnosed with breast cancer. So that's how I got into the thermography. I also have been involved in a lot of different nonprofit groups, different national groups. I've run different support groups. I've started different support groups. So I've been helping women that have had breast cancer deal with their treatment and the aftermath of treatment, and hopefully try to avoid a recurrence, as well as helping women to avoid the diagnosis in the first place. So then I also started doing coaching. I am a certified breast health coach. I also own a thermography practice here in Florida. Previously, just a little bit about my history in the back, I am a clinical psychologist, and I did work as a psychologist for about 20 years. So I've always been in the helping profession. I just love to help people. It's my passion. And so that's a little bit about me. And we'll talk a little bit about the thermography, what it is. If you want to go ahead and start, we're going to put up some slides just to show some images. I know that people like visual. Yeah, there we go. So the visuals sort of help understand things a little bit better. So this slide is showing you now. I know it's Breast Cancer Awareness Month, and everybody's aware that breast cancer is very prevalent. It's hard to find a woman that doesn't have somebody in their family or a friend or a neighbor, or hasn't been impacted by knowing someone that has been diagnosed with breast cancer. So the numbers that are out there, 1 in 8 women will develop breast cancer over the course of their lifetime. That's actually older statistics. They believe that it's probably closer to 1 in 7, 1 in 6. The latest statistics say that by 2030, they think it's going to be 1 in 3. So breast cancer is not going away. It's not decreasing. The current methods that we're using, the current gold standard of detecting breast cancer, is not helping to reduce the cancers. And that's where thermography comes in. We're trying to help prevent and reduce cancer, not just detect it or detect it early. We want to help people not get it in the first place. Go ahead and go to the next slide. So any woman, obviously, if you're a woman and you have breasts, you're at risk of developing breast cancer. A lot of women, pardon?
Men too.
Men too, less frequently, but all women are at risk for developing breast cancer. And a lot of women believe that, you know, if it doesn't run in their family, if there's no family history, then they don't have to worry. But really, family history is a very small portion of women that get breast cancer. There's no family history in my family. And a lot of women that I know have no family history. So there are, and this slide's interesting because if you look at the thing down here at the bottom where it says wear tight-fitting bras or clothing, that fits in with our no bra day today. So really that's about lymphatic drainage. You know, you don't want to be wearing things that are not going to let your lymph carries away toxins, and it can carry the toxins away from the breast tissue. And if you're wearing those tight-fitting bras, it can really have lymphatic congestion develop, which can be a risk factor for developing breast cancer down the road. But there's also the emotional things. Having a lot of stress in your life can increase your risk. Of course, all of the electronics, you know, we've got so much of the radiation coming from Wi-Fi and cell phones and microwaves and computers. Being overweight, you know, you always want to eat healthy and be at a good weight to avoid all diseases, but especially breast cancer as well. You know, our food, our air, our lifestyle, all of these things can lead to an increased risk for developing breast cancer.
Well, I know I see women, you know, take their cell phones and they'll shove it in their bra and like they have it right up against them. I'm like, oh, that's so bad.
Yep, yeah. I would highly recommend that no one do that. Not good at all. Yeah, they've done studies on men who've put them in their back pocket and have had an increased risk in prostate and colon cancer if they're carrying their cell phones in their back pocket. And I'm sure that you know would also be obviously not the prostate, but maybe the colon for women as well. So let me show the next slide. When we talk about dense breast tissue, this is a mammogram. This is not a thermogram, but this is a mammogram of a woman, and it's showing different women with different breast density. So this first image here is showing a woman with very minimal density. It's mostly breast fatty tissue. So when you have a tumor shows up on a mammogram as a white dot or a white spot. So if you have, like in this first image, if you have low density, just normal fatty tissue breasts, you're going to be able to see that white tumor if there's a tumor in there. The second image is showing where there's getting to be a little bit more density. Density shows up as white on a mammogram. When you're looking at this next one, this breast tissue is dense. It's getting real dense. And this last one is extremely dense breast tissue. Over 50% of women have dense breast tissue. This last one is what a lot of women have dense breast tissue. And, you know, you look at this last picture, how is the radiologist going to be able to see a white spot when it's all white on here because of the dense breast tissue? And that's what happened to me. I had dense breast tissue. They didn't really explain to me what that meant. And the mammogram didn't see my tumor for 3 years in a row. And then I felt the tumor myself. And by the time, you know, I went through all the testing and everything and the size of it, they said that it had been growing at least 8 to 10 years. And it just wasn't seen. So mammograms are missing about 50% of all tumors with women with dense breast tissue. So if you have dense breast tissue, it's always important to have another test done as well. If you are still doing the mammograms, just to make sure that they're not missing something.
I mean, seeing it this way, yeah, that's eye-opening for sure. At least, I mean, for me, I had no idea that that's what the mammogram looked like. And I know every year when I go, they, keep telling me I have, extremely dense breasts, and they have to do ultrasounds on top of the mammograms. And, it's always like, but I started mammograms at 26 years old because I was having issues.
Yeah, and it is good that they're sending you for the ultrasound. What frustrates me a little is when they say, oh, you have dense breast tissue, so we need to do a mammogram every 6 months and make you come in more, because it's not going to show anything different if you come in more frequently, and they can still miss it, and it's going to radiate you more. And that radiation, every single time you have that radiation, it's going to increase your risk of developing breast cancer down the road. So what a mammogram is doing is it's a test of structure. It's looking for a solid tumor that's already formed. And so it's not able to provide you with any information on preventing breast cancer. It's just waiting. It's playing the waiting game, where it's just waiting until it can finally see that solid tumor that's large enough to be seen. And sometimes it's even large enough, but it's not seen because of the breast density. And so thermography is really trying to help women to look at what's going on within the breast before that tumor develops, and helping them, with time to take action to be preventative.
That's why I started coming to see you.
So the next slide, I'm going to show you. So this is basically the thermography system. It's very simple. There's a camera. It's a specialized thermal camera that's hooked up to a specialized computer with software. And so you're not going into a machine like an MRI. Nothing is touching you. There's no squishing or pain involved at all, because nothing's touching you, and there's absolutely no radiation. So nothing that's going to cause problems or could potentially cause cancer. What we do is you're just standing in front of this thermal camera, and we're just taking images from all different angles. So it's as easy as getting your picture taken.
Mm-hmm.
And then let's go through, I'm just going to show you some actual images, because like I said, a picture says 1,000 words. This is, it's easier to visualize what thermography does if you can actually see some real pictures. So when we take our images, we provide our images 4 different ways, and I'll show you that in a minute. You'll get them in black and white. You'll also get them in what's called reverse polarity, or white on black, and then 2 different color schemes. And the reason why we do that is because sometimes it's easier to visualize what's going on or what the doctor's talking about in the report. When you see things in black and white, sometimes it's easier when you can see the colors and know where the heat is. So this is a younger patient who, as you can see on this left breast, has this massive white spot right here. And that's heat from the thermography camera. Yep. And so that actually is a tumor. Thermography does not diagnose, but it does identify where there's issues. And if there's extreme issues, then we recommend following up with an ultrasound, which is that test of structure. An ultrasound also does not use radiation, but is then able to detect those solid tumors. And then this woman actually went and had a biopsy and was found to have a tumor. So this is just sort of showing you the difference, but in a black and white image, see how you can see all the different vascular patterns, the little veins leading up to things, and you can see the difference between, her right breast, which you can see this one vein right here, but otherwise it's pretty smooth, the colors. And then in comparison to that left breast, where you see all that vascular activity, because when a tumor is starting to form, that's what it's doing. It's sending out these chemical messages to the veins, and it's developing little capillaries and arteries off of it so that it has a blood supply to feed it so that it can grow. And you can actually see all of that and visualize that with the thermography.
Interesting.
Yep. Go ahead and show the next one. So this is how we provide every image that we take. We give to you 4 different ways. So the top left-hand corner up here, this is black and white. And then this one is reverse polarity, or what's called white on black. So In the black and white, everything that's white is hot. So that's this area over here is hotter than the other breast. When you reverse polarity, then everything that's black is what's hot. So this is just the opposite color scheme. And then we have the two different color patterns on the bottom. Most people are familiar with this bottom right corner where you see all the different colors with thermography. That's what most providers provide. They only provide it that one way, but we provide it all four ways. So when you see this image, you know, around the neck, under the armpits, underneath the breast, you'll see more of the reds and the whites and the oranges. Every woman is going to turn out a little bit hotter in certain areas. We carry more heat under the armpits, under the breast. We do acclimate you before we do your images. We keep you in a cool room for a minimum of 15 minutes, but you're still going to turn out warmer in certain areas. But what the doctor is looking for is the symmetry versus asymmetry. So when you see these two hot spots on the neck, it's okay because it's symmetrical. When you see that heat under the armpit, it's okay because it's symmetrical. What's not symmetrical is down here in the breast area, where you see on that left breast, this big area where it's red, white, that's where there's more heat, and that's where there's more of a suspicion that something could be developing or did already develop in that area. Go ahead to the next one. So thermography looks at more than just, are there areas of the breast that have more blood flow, a potential tumor that's starting to grow. And so I wanted to show this slide because this shows some of the other things going on. First of all, this woman's very vascular. There's a lot of veins running through both breasts, and that's okay. It's you know, as we age, sometimes we get a little more vascular. You know, you have to be careful when there's a lot of vascularity, because when there's more veins that are developing, arteries, capillaries, all of that could be feeding tumors. But what I wanted to show you on this slide is all of this splotchy pattern up, you know, from her chin and neck all the way down through her chest. It's even up, you know, under her armpits and down between the chest. So thermography is going to look at the breast itself for that increased heat. The doctor's also going to look at the thyroid area here in the neck to see if there's a thermographic response from the thyroid, because thyroid issues can also increase your risk of developing breast cancer. He's going to look at the side or axilla area. We take side images to see if there's any lymphatic congestion. We talked about how that lymph fluid has to flow and get the toxins out. And he's also going to look at the level of fibrocystic activity. And the fibrocystic activity in the breast is what indicates if there's hormone imbalances. So this woman has a lot of fibrocystic activity. She's got this splotchy pattern all over, which is an indicator that she has imbalanced hormones. And that usually is because they're estrogen dominant. And we know that if you carry high amounts of estrogen for long periods of time, that is also a significant risk for developing breast cancer. Let me have you go to the next slide. Oh, this one's just showing very clear vascular patterns. You know, it's really interesting to see that, you know, thermography, the details that thermography can pick up and can see. You know, it's not just looking at this breast where it's fatty tissue or the white dense cloud tissue that's just a big blob of white density. Thermography is showing, because it's looking at the heat, it's showing where all of the vascular patterns are throughout the chest. It's also, you know, we also do full body scans and other ones, and this is interesting just up on the mouth. As a side note, this woman had some bacterial infection in the mouth that's leading to bacterial drainage. So she's got some dental pathology going on as well. Let me see the next slide. So I'm going to show you a before and after. This is a little bit more of what I was talking about as far as hormone imbalance. So all of this red is an indication that this woman has a lot of fibrocystic activity and some hormone imbalances. And thermography is catching this so that you can, again, make changes, do something about it. So this woman went and saw her doctor, talked to them, and we had her measure her vitamin D levels, and she was vitamin D deficient, so she started taking vitamin D supplement. She also started taking some iodine supplements and a bioidentical progesterone cream. So bioidentical progesterone is similar to the hormone that your body makes naturally. And if you have excess estrogen, it's going to pull that extra estrogen out. And it's going to help balance your hormones. So the next slide shows the same woman after 3 months after doing those simple treatment things. So see how all of that red splotchiness has decreased? Her colors are starting to look much better. So thermography is such a wonderful tool to help women look at their risk and then do something about it. And this is a perfect example of somebody that, if she had stayed highly estrogen dominant for years, her risk of developing breast cancer is significantly increased. And now, hopefully, she has decreased her risk just by taking those simple precautions. Yep, the next slide. So I just wanted to mention that, thermography is a wonderful tool. There's thermography centers all over the country. And if you have access to it, I would highly recommend it. It just provides you with a risk assessment and so much more information than just, is there a tumor there already or not, and waiting to detect that tumor. Like I said, you're going to get information on your thyroid, lymphatic congestion, fibrocystic activity, as well as your risk for developing breast cancer now or up to 8 years in the future. So there are, though, different levels of thermography cameras on the market. And just like, I explain it like an iPhone. There's the iPhone 4 takes pictures, the iPhone 8 takes better pictures, the iPhone 11 takes even better pictures because the technology has advanced. So this is on the left side, these green images with more of the yellows and oranges. This is all the same woman who had her thermography done with a lower resolution camera. And that's what the images look like. And then on the left side, like I said, we provide our images 4 ways, not just one, are the same 3 poses of that same woman with the higher resolution camera. So Space Coast Thermography, we do have the highest resolution camera on the market. The difference is between these 2 images, this is taking about 19,000 temperature readings or pixels per image, and our camera is taking 307,000 temperature readings or pixels per image. So there is a big difference.
That's a huge difference.
And as you can see on this last image, the bottom one, on the left breast down here, you can't really see an issue or a problem on this one, but then you come over here and it's just significant how you can see with the higher resolution camera. So it is important. So I would recommend that that's a question that you ask. If you're looking for a practice to have thermography done, you want to make sure that they're acclimating you in a temperature controlled room. You want to make sure, that they have a high resolution camera. It's just real, you'll get better images and more information if you're going with the better technology. And the next image, so this is just some information on Space Coast Thermography, where we're located in the Suntree area, and we are running some specials for October. Also, and that's, our website and stuff if you wanted to know that. So as Kristen had mentioned, I also do breast health coaching, and I've been helping women with their breast health for, many years. I do offer with my breast health coaching, which that website is breasthealthcoach.com. And I do offer a free monthly, I call it the Breast Nest. And it's a monthly educational online meeting. So anybody can join from anywhere. You just go to the website to register. And I talk about different topics related to breast health every month. So like last month, we talked about rebounding, which is a great thing for lymphatic congestion and getting those toxins out. This month, we're going to be talking about iodine and how it affects breast health. And there's lots of different topics that we'll be discussing, from supplements to nutrition and diet to different detox methods. So if anybody's interested in joining the free breast nest, or just, jumping online to see one of our educational meetings, it's at the breasthealthcoach.com. Under events, you can register for the breast nest.
That's great, because yeah, there's lots of ladies that are, in different parts of the country, but there's quite a few who are here on the Space Coast too. So I highly, recommend that you check out the thermography if you are local. I went and had an appointment with her, I think back in about June. So, during, quarantine time, I went and did this. So I'm excited to come again. I think I have to come back in December and have my next scan, just because, and it's not that you need to do it that often, but because I do have dense breasts, I need to go again at the 6-month mark to determine, to get that baseline, to see if what they're seeing is just my normal or if that's a potential problem. And then from there, what do you recommend? Is it
right? Then hopefully, hopefully after that, it would just be yearly. The doctor, we do have a board certified medical doctor who's been doing the thermography readings for many, many years. And he will make a recommendation based on all that information that he gets. He'll put together a report and make a recommendation on, if you should come back in a year, if you should come back, at that 6-month mark, just so that we can keep a closer eye on things. Or if, you have a major issue going on, he might say, we highly recommend that you do go have an ultrasound, and then you might want to look into A, B, and C. He'll make some suggestions, recommendations, and then he might want you to come back in 3 months. Like that one woman that had all of that fibrocystic activity and those issues, she came back in 3 months to see the progress. Other people might not need to come back until a year. The goal and the hope is that between ages 20 and 30, you only come every 3 years. We want to monitor your breast health. So we want to monitor your breasts while they're healthy. And if there's any small physiological changes, we can catch them. Then from 30 on, we want, hopefully to just come in once a year. It's just like having your annual GYN exam or annual blood work for your primary doctor. This is a once a year preventative thing that we want you to add to your regimen for your health.
Very interesting. Well, thank you. I really hope that, you guys found this useful, because I know I learned a lot, and I've gone in and, met with her, and I still learned a lot more. So I really appreciate you being here today. And I'm going to go ahead and just stop this screen share real quick, just to make sure we're back on screen here. But I really appreciate this. And I know October is a crazy busy time for you, but we are a community of women. We're trying to help out other women. And I always say, the more you know, the better you do. So now that you have more knowledge, you can be more proactive and get your health under control, or, preventative too. Because I know I have quite a few women in this group that are either going through breast cancer right now, or are past survivors as well. So, we want to prevent those future occurrences and, get you to the right place. So
absolutely.